Alright, hi guys, very good evening to all of you and welcome to our today's YouTube session where we shall be planning and discussing the strategies that what should be your next step after the result that has been announced. I can totally understand depending on the messages that we have got, looking at the result that we have got, that most of you may be very much devastated, disappointed with the scores that you have got. Maybe you you never expected that kind of score. We can totally understand that. So we are here to talk about the same and what should be the next step, what should be the strategy ahead. We will also discuss that. Moreover, I will also take the question from all our audience, those who are having any query about this particular topic in FMG examination for the upcoming December 2020. So let me start this section very quickly, but before that, please let me know if I am clearly audible and visible to all of you guys. For all those who are new here, there is a live chat section in which you can reply, you can talk, you can put your queries, and in this live chat section only you can actually reply if I'm clearly audible and visible to all of you. A very good evening, Dr. Vladimir Putin. I hope I'm audible and visible to all of you guys. A quick confirmation, please. Hi guys. Okay, seems all fine. So a couple of announcements that I'm having before I proceed further, that if you're subscribing to Unacademy, please do not forget to use the code PHARMA10 to avail a 10% off in your subscription. Do remember, you can use this code in buying Unacademy Plus subscription. You can also use this code to buy an iconic subscription. So what is iconic subscription? Is a combination of Unacademy and Prep Ladder both, where you will have benefit of both of them. The new batch for FMG, Focus FMG 2022, it's one of the comprehensive batch that is going to start July 11 and it will continue till December. It's one of the well structured class where they will be covering all the 19 subjects by all the top educators of the country. At the end of the session, you will also be having access to the PDF notes that we have discussed. Not only that, you will also have access to more or less around 24,000 plus MCQs. You can attend these classes live at any point of time. If you miss any of these classes, the recorded version is readily available. We had a good amount of student passing in this June 2022. We got a score up to 215, and plus there are many students, those who have got 200 plus scores just with the proper strategy and proper guidelines that they have utilized. In subscribing any of the classes that we have, or just a minute, you can use the code PHARMA10. I hope it is already visible to all of you guys. PHARMA10. There is a NEET PG Med Scholar Grand Test that is going to be conducted on July 27 at 9 a.m. So you guys can mark this calendar on July 17, not 7, sorry, July 17 at 9 a.m. And for attempting this test as well, they might ask you for some code. So you can utilize the code that I have given you, PHARMA10. PHARMA10 you can avail for enrolling into multiple courses and also for attempting this course that we have. Okay, PHARMA10 for this particular grand test that is going to be conducted on July 17, 9 a.m. NEET PG 2023 test and discussion batch specially designed for the repeater student, those who have just given the exam and could not get the score or the rank that they are expecting. For them, it has been started. Do remember, in this one I have already taken 2 to 3 classes like general pharmacology, ANS and CNS. I have already covered. So we are giving you one topic every day, and at the end of the day at 6 p.m. every day we are discussing that topic. Like today at 6 to 8 p.m. I have discussed central nervous system. Tomorrow we'll be talking about cardiovascular system. So if you are one of the plus subscriber, make sure that you attend these tests and discussion series. So this is not only for pharmacology, but it's for other subjects as well, for all the 19 subjects. The other different charges of the subscription that is available, depending on the duration, different charges are available for the plus. Then we also have for the iconic subscription. Light is only if you want to access the tests and test series, and for Prof 1, where you will have access to all the Prof 1 subjects with these particular cost, you can utilize again the code that is Pharma10. Okay, so after this short introduction about this new offering, let's get started. FMGE Solutions 7th edition will be out soon. The work has been done from our end. We are expecting the editing work to be done soon, and maybe by the end of the July or the first week of August we are expecting that book. If everything goes fine, yeah. Okay, so let's get started. The very first question that I'll be firing from for all of you, because I have got this question from many of the students. Sir, exams are over, couldn't get the desired score. What's next? Many of you must have given this examination, must have got a score, let's say 140, 141, 145, 148, 149. So if any score that is below 149, it's of no use right now. All of you must be feeling shattered that what to do. You must be feeling doomed. But we can totally understand that feeling that you guys are going through, that you worked hard, you studied well, but still due to some reason, due to one day, whatsoever reason, you could not perform. What to do next? My simple few of the important tips that I'll be giving you will be of course, life isn't fair. You might feel this that way, that life isn't fair for me. Why only me? Some of my friends, they couldn't study well, they didn't attended this particular test series, they didn't attended this regular class, or they didn't attended this XYZ grand test, but still they managed to pass. Why me? Why I couldn't get this? Why I couldn't get through the examination? I will totally tell you, I would totally understand, and I will tell you that if you are feeling something like this, you have to ask yourself a couple of questions. You have to bring out some time. Maybe some of you are very much into sad mode, and all of you maybe sitting and staying away from all of your friends, or maybe from your family members. At this point of time, if you want to stay in this, or if you want to come out, it's totally, of course we all want you to come out, but how soon you are coming out decides what will be the upcoming result. Let me repeat again. All of you may be living in solitude. Maybe after the result you don't feel like having a moment with your friends, or talking to your friends, or listening to your teachers, because of course the result is not in your favor. It's totally up to you how soon you want to come out, because the sooner you come out from that sorrow section, the better result will be expected in upcoming days. So weep as much as you wanted to weep. If you want to stay in sorrow as much as you want. But when you come out strong, stay strong, come out strong, stay strong. Ask yourself a couple of questions. Analyze these important points. Where did it went wrong? And how will you analyze this? Once you accept the score. Maybe it will be very easy for me from my end to say, okay, accept this. But what choices do you have? Very first thing, what choices do you have? I can totally understand, maybe some of you will be saying, sir, I wrote this correct, I wrote that correct, but maybe in the examination, it's only you who have written, and the examiner or the machine which has checked the your calculated your score, maybe these two people know. It's only between you and the machine. So the first step that I would tell you is to accept it. And believe me, the sooner you are going to do, the sooner you will come out. Do it as soon as you can, because the time is going daily wise, you are losing some of the time. So accept the fact, and then ask this question: where did it went wrong? Put your hand on the heart, ask yourself, where did it went wrong? I did everything, Was there any problem with practicing? Was there any lacuna that was left in giving the grand test or doing MCQs or in revision part? Okay, maybe you have revised. Was there any problem with some of your weak areas that made you, to choose some of the wrong option? That is, we always say that the worst enemy for any one of you will be the silly mistakes. You think that you are marking correct, but it's usually not correct. It could be due to misreading the question or interpreting the question in a wrong way. That is coming up with the silly mistakes. So analyze where it went wrong. It's only you can analyze. No teacher. I am sitting here, I am talking to you. I cannot just say, even if you are coming in my offline class or talking to me a one-to-one, I cannot say. I'll be asking you only, and then I can come up with a solution. Okay. If you are saying this, maybe this has the one of the problem. But since there is a one-way communication here, it's only you who can analyze where did it went wrong. What was the mistake that according to you has happened? You have to ask yourself. Did you ignore something you knew? I mean, some of your weaknesses. Did you knew that, okay, this is my weakness, and did you really ignore that weakness? Let's say, I'll just give a couple of examples. Let's say you think and you already are aware that your pharmacology is a little weak, or you are making a lot of mistakes in pharmacology. Did you ignore that part? Or let's say if your medicine is weaker, or if you're having trouble in medicine and you got some of the advice from some of your senior that, okay, you can leave medicine and still you can get a decent score. Did you had, do you have any story, anything like that? Do you have a story, something like that? You have to ask yourself. Or maybe sometimes your teacher has said, okay, you do not know this, focus on your basic. You knew that your basics are weak. Did you ignore that? You have to ask that. It's very high time. Once you're coming up out of this, then I'll tell you, okay, let's get back on track. And I'll start with the rare MCQ technique. What is rare MCQ technique? Whatever happened in the past, leave it in the past. If you leave your life in the past, you are going to stuck in there. Come out of that. Okay, it has happened. Fine. Result aa gaya, koi dikkat nahi. You are not the only one. Along with you, 90% of the students are also there. The passing percentage is hardly close to 10%. So, along with you, 90% of the students, those who have given the exam, plus there are other students, those who are coming, they will also be giving. There are a lot of students. You are not the only one who has suffered this. So, leave that in the past. The faster you leave, the better it is. Utilize the rare MCQ technique. You'll have to start with the basics. Read. We will be telling you what are the schedules, how can you utilize, how can you make a better schedule. Analyze whatever you have read. Analyze in terms of a patient. Okay, you have read, let's say, brachial plexus, and you are reading what is the root, what is the trunk, what is the division, what is the cord, what are the nerve roots, different roots you are reading. You have to analyze it in terms of a clinical setting. That, okay, if a patient is coming, what is the site of lesion, and if this is the site of lesion, what will be the appearance? If they are talking about a claw hand, a partial claw hand, or if you're talking about the Potter tip deformity, whatsoever, you'll have to analyze it. Ek baar se, talk to yourself. Analyze means, and whatever you have read, try asking yourself the question. Analyze whatever you have read. What meaning does it have? If you are going to sit in the clinical setting, how it can benefit you. That is the kind of analyzation that I want from you. Whatever you have read and analyzed, you have to revise that. Without revising, it will be a total waste. Educate. You can educate yourself, but if you have a group of people, not more than 3, in a group study, you will have to do that group discussion as well. That will be educate. Group discussion should not be more than 45 minutes to 1 hour in a day. You study, and educate means you can fire your question not to demoralize anyone, and if anyone is demoralizing you also, that group is not healthy for you. So read, analyze, revise and educate. Whatever you have read, try to pass on this information. Okay, you have read this, listen to me. So what you're going to do, you are revising yourself and you're also passing on some information. So both the groups are going to get benefited. The one who is listening to you, and of course you are the one. So rare MCQ, motivate yourself. Keep yourself in always motivated form. What has happened has happened. I am repeating the same thing again. And do not get demotivated. Okay, what will happen if I get the same kind of question? What will happen if I do not read this question and the question is going to be asked from this topic? That kind of negative thoughts, try to avoid as much as you can. How can you avoid? By always indulging yourself in the positive thoughts, by always surrounding yourself with the positive people. Because we all know that out of 10 people, you will be finding 6 to 7 that those will be somewhere or the other might pull you down. So you'll have to choose your environment very, very carefully. Keep yourself always, keep your confidence always high. Okay, what has happened? It was not my day. I could not do this, but I will be doing this. Whatever I am reading, let's say I am reading CNS today, I have read epilepsy. But if a question is going to be asked in epilepsy, I will be reading about, let's say I read about generalized seizures. How will the patient present? Think, खुद से analyze करो. If there is a generalized tonus, clonus, all body will be involved. Where is the problem lying in the brain? And if I'm going a voltage gated sodium channel blocker, what is the effect? You have to make it in a form of story. है ना, एक बैकग्राउंड में there should be a story, a movie चलना चाहिए. मूवी मतलब उसी के बारे में, about that particular topic, है ना. Imaginary animation should run. Okay, if the voltage gated sodium channel is blocked, there will be no glutamate. Okay, this is how it is going to work. In the absence seizure, this is the problem, this is the firing frequency. You'll have to read the topic like this. And most of the students I have seen, they will be continuously, they will be mugging up. Without understanding what is given in the notes, they are going to mug it up. That is the wrong approach. Any student who is following and who is reading by understanding, believe me, they are doing good. Then questions. Most of the students, they will be leaving this part. They are so much into the theory that they keep on reading the theory, they keep on revising the theory, but they tend to leave the most important part of the preparation, that is solving the questions. Do remember, whenever you are reading in a day, your 75%, I used to say 70-30, but now I am telling you 75% and 25%. In a day, your 75%, right now you have around 160 days time, 170 days time. So right now you do theory, of course this is important, but whatever you have done in the theory, try doing the MCQ of those in 25% of your time. So when you look at your time, instead of doing 70-30, I have done a little bit, I have given more time to theory. So put your at least 2 to 3 hours time on the daily basis for the MCQs. Even if you are putting 2.5 hours, that will be sufficient. Whatever topic you are doing, make sure you are doing the MCQs. So utilize or start with the rare MCQ technique. You have to read, analyze, revise and educate yourself, educate your friends. Keep yourself motivated, keep your self-confidence very high, and make sure to do the MCQs usually on the regular basis. Do not keep it for weekly basis. Do not keep it for the weekends. Do not keep it that I will do it after the 3 months. No. If you start doing it from now, by the end of the time, by the end of the 3 to 4 months, you would have practiced massive number of questions. Okay? Now the question comes, from where should I do the question? Okay, I have read this XYZ notes. Should I read the same again? We will talk about that. We will come up with one of your solution. If you have any such question, keep that question. I will take all those questions subsequently. Genius is asking, are you going to take free classes? Definitely, many. Misbah Iram BAST bust sir, I couldn't get you doctor. North Indian recall में 176 बन रहे हैं, एग्जाम में 140, प्रीवियस टाइम 145, इस बार कम हुए हैं, थोड़ा टॉलरेट नहीं कर पा रहा है, ऐसा कैसे हो रहा है? गुड टू गो द पहले से. ओके, I'll be taking Dr. North Indian. Please be ready with your question. I'll have a very good reply for that. I'll give you that reply. Just continue because we are talking to a lot of students. So let's continue that what should be your strategy ahead and how can you improvise your technique, how can you improvise your schedules, and what are the different schedules that we can actually come up with. You have to read, focus more towards the topic. Now when I say do MCQs, what is the advantage that you'll be getting? You are going to see what is the mindset of the examiner, what kind of question examiner is asking. So you'll see a couple of topics that are being repeatedly asked. So when you go through that, and after that when you go back again to the notes, retrograde, when you go back to your notes, you'll realize, okay, this topic I am reading right now, there was a question on this topic. Now your mind will start to think in the same way. When you see the next topic again, your mind will start to think in the same way, okay, from this particular topic, this type of question can be framed. So I'll have to be very, very careful in this. So questions are never repeated. I will never say that. If any question that are being repeated, that is just a coincidence. But I can say that yes, topics are being repeated. Like there are topics on gout being repeated, topics on immunomodulators being repeated, topics on some of the monoclonal antibodies being repeated. So stay focused on topics, whatever topics that are being asked. Basics must be very, very strong. Now, how can you know whether your basics are strong or not? While doing the MCQs, or maybe while attending the classes, you yourself can be the best judge. No one else, I or your friend or your parents or your teacher, no one can judge better than you that whether your basics are strong or not. Only you. Put your hand on the heart, ask yourself whether my anatomy, physiology, biochemistry, patho, pharma, micro, forensic, these 7 subjects, how am I in these subjects? These 7 subjects, I repeat, these 7 subjects comprise of marks more than 100. What are those? Anatomy, physiology, biochemistry, patho, pharma, micro, forensic, 7 subjects. Marks more than 100, close to 100. Okay? Now subjects are equally important. If let's say forensic is the smaller subject, let's say you are telling, okay, I have a 20 hours notes of forensic. So that is not less important subject. 20 hours ka hai, but those marks are highly scoring. Even they are going to ask you 6 to 8 questions, they are highly scoring, you can easily get those. So they are also important. If you are telling, okay, pharma se 28 questions are, they are very important and they are more important than a smaller subject, I do not agree to that. Each subject is equally important. According to the length of the subject, the marks are divided. So definitely each subject is equally important. If anyone is telling read only 14 subject, read only 15 subject and you will pass, run as fast as you can, run from there. Do not take that advice, leave that advice then and there and run as fast as soon as you can from there. Each subject, when I say each subject, I am talking about all 19 subjects are important, guys. Do not even think of leaving a subject, because believe me, the subject that you are going to leave, you never know, and you'll be surprised to see the topic or the subject that you are going to leave. You'll get to see every 3rd and 4th question will be from that topic or from that subject. It has happened in the past, it can happen again. So no subject is less important. Make sure that you are going through each one of them. Your weaknesses, you'll have to accept it first. This is the first step. What is the first step? That you will have to accept your weaknesses, because until you do not accept, you will not work towards it. If you continuously saying, okay, my anatomy is very strong, and if they are going to ask you a simple question on let's say some joints or some important muscle insertion or origin or some nerve supply, if you are not able to reply to that, I don't think it's very strong. Okay? So only you can tell that, okay, this is my weaknesses. Don't tell to the world. No need to announce it on social media. No need to announce it on your Insta or Facebook. Okay, this subject is weak. No. Tell to only yourself and work on that weakness. So if your weakness is always and always troubling you, stressing you, I would tell you, use this technique, fragmentation technique. Use this technique. Let us say if this is the weight of your weakness, and under this 100 kg weight, let us say this is 100 kg weight, and under this you are always stressed, you are not able to carry on this load of 100 kg, I always say divide them into fragments. Don't take it as as a stress. You continue to read what you are reading, and on the regular basis, on the daily basis, you keep at least 45 to 50 minutes on the regular basis per day. इसके लिए आप अलग से शेड्यूल दो ही नहीं. There is no such schedule like, okay, in the month of August I will be reading it for 5 days. No. Bring them in your life, day-to-day life. This should be your part. And believe me, once you spend at least 3 to 4 week time on this, you will realize the amount of confidence that you have in this subject is more than any other subject. So you stay in touch with this continuously. If some relation is not working, you'll have to pay attention to that. You'll have to stay with that to make your bond stronger, to make your relation stronger. You'll have to stay with that. Fragmentation technique does the same. It will be, you are going to divide them into 100 small fragments. ठीक है, 100 small fragment में इसको divide कर दो. This will become more and more easier. Multiple fragment में divide कर दो. So you read one portion. Let me talk about myself. Let's say you are telling, okay, sir, my pharma is weak. No problem. Can you leave that? Can you leave 28 to 30 question out of 300, and you expect that if you're not able to get 150 out of 300, will you be having higher chances of getting 150 out of 270 or 265? The chances are much lesser, right? Can you leave that 30 marks, those easy 30 marks? No. So what you can do, you start one topic. Let's say you open the book, you read pharmacokinetic, one part, absorption. If you are able to do absorption and do its MCQ, just read for 30 to 40 minutes, do its MCQ in next 15-20 minutes, close it. That's it, finish. Next day, when you open it, flip those pages of absorption. What are the different types? What is passive diffusion? And how is it different from active transport? You एक बार देखिए. Make sure it goes in front of your eyes once more. Okay, I have read it yesterday. Today I am going to read the next part, that is distribution. One part. Read it, close. If you can make, like, let's say, absorption distribution in one day, it's totally up to you. Because you are the master planner, you are the one who can tell that, okay, this is my weakness and this is the speed that I can take up. So fragmentation is always and always going to help. Next day you start the next one, let's say, and the next day you can start with the pharmacodynamics. Then next day you can read about clinical trials. So just one topic, clinical trial, very small topic. But make sure if you read clinical trial, you are reading most of the question that has been asked, most of the topics, and then close it. Go back to your usual schedule. But this 45 minutes to 50 minutes should be resolved for these areas. Once you are done with, let's say, your 1 week area, pharma, in let's say 20 to 30 days, you start with the next one. So for every student, maybe there will be 2 to 3 subjects in which they are highly scared, and that is the one that is creating trouble in most of the time. You'll have to accept that fact. You'll have to utilize this fragmentation technique. So the same 100 kg example, if let's say you are living on the 10th floor of a building, and if I ask you to carry 100 kilo load immediately, you might feel some difficulty, somewhat many difficulty, lot of difficulty you'll have to face. You won't be able to carry that very easily. You'll be stressed out. If you think about that, okay, how it is, how am I going to carry, this is 100 kilo, this is going to trouble me a lot. I will tell you, on the daily basis you are coming up and down. Every time you go up, take 1 kg or take, let's say, 2 kg. If you can carry 2 kg, if you have a capacity to carry 2 kg, carry only 2 kg. You'll realize after a couple of days that weight has markedly reduced. But if you keep on thinking without working on it, the weight is not going to go down. Instead, the next work will come, and this 100 kg may keep on increasing to 110, 120. It might become 1000 kg in upcoming days. So you will have to start utilizing this step. Time management and revision strategy, how you are going to take it. You always and always start with a schedule. I'm sure all of you must be having a schedule. We have discussed this in past. I'm discussing it again. Please start with the schedule. I'll be taking all the questions. All the questions I'll be taking. Dr. Vladimir, I'll take all the questions. Write that schedule on a paper. Don't think, okay, my schedule is here. No, even if it is here, pen it down. It's my very, very strong recommendation. Write it on a paper. Now there will be a schedule which you are going to make. If you are, let's say, going to do the self-study, you are going to make a schedule that okay, for this particular days, for this particular week, I'll be studying about, let's say I'll be studying about a subject like pharma, then I'll be studying about a subject like physio, then I'll also be studying about a subject like anesthesia. So in the upcoming 10 or 12 days, I'll be reading about these and I'll be finishing this. There are multiple kind of schedules that you can make. Everyone will have a different approach. I will share my approach to you. If you find it useful, you can utilize that. So draw it on a paper. Let's say you are having around 170 days, around 100, not 130 days. I think you are having around 170 days now, right now. 170 to 180 days. Take 170 to 180 days. The first 100 days, you are going to read it for the first go. Then 30 plus 30 and 10 and 10. This is the first, second and third revision. Now how can you make this 100 days? Let us say all of you are actually following a self-study. Most of you may be having your own app, or you are a part you have already attended some XYZ class and now you want to do self-study. So all the students, those who are planning for a self-study, listen to me now. You might be having, okay sir, do I have time for finishing all the syllabus in due time? Do you have any other option? I don't think so. Everyone is going to do the same, you have to do the same. We do not get any extra time more than 24 hours. Everyone will be having their exam. Most likely in December, you will also be having your exam. Time is limited. You have to utilize the smart study approach. To finish it once, revise at least 2 to 3 times more. At least 2 to 3 times more. Do I have time for enjoying the luxuries like everyone else? See, if you would be like everyone else, you would not come to this field, medicine field. You have already chosen one of the toughest branch of studies, the medical science. So for the next 4 to 5 months, you cannot ask for these, that okay, I'll have, my friends are going for the party, they are not even doctors, they are having much easy life, they're enjoying their life, they're having their weekend party, I'm not able to go, and I'm here listening to sir, I'm reading pharmacology, I'm reading XYZ subject. So I would say, okay, it's absolutely fine. You have to spend the next 5 to 6 months in this kind of scenario. But believe me, once you come out of this, you'll feel much relaxed, you'll feel much better. You'll be able to enjoy each of the parties that you're able, that you're going to attend. Compared to now, where most of you feeling very heavy, most of you feeling very much devastated. So do you have the time for like everyone else? When the question comes like everyone else, you're not like everyone else at all. You have not chosen that field of everyone else. You have chosen medicine. So definitely you have to be a little bit into solitude for the next 5 to 6 months. You have to be very much reserved with your schedules. So for the students, those who are going to study self, what are the sources of learning? How will I start? Class notes, whatever class note that you have, your class notes are very, very powerful. See, we are not here to discuss what is good or what is best. Everything is good. If you find yourself, you can judge. If you feel, okay, I'm not able to solve much of the question from this, now it's time to think. If you're not able to solve, why are you still with that? Okay? So class notes, MCQs. Now while doing the MCQs, I have seen there are a couple of books in that explanations are given in 1.5 pages, sometimes more than that. So when you are doing the MCQs and you are able to solve that MCQ, do not fall into the trap of the entire explanation thing. That will simply eat up most of your time. So in 1 hour, you will be able to do, let's say, hardly 25 to 30 questions, or maybe less than that. So for whatever question, if you know the answer, why behind the answer, if you know that already, it's absolutely fine to skip the explanation. If I'm going to talk about FMGE solutions as one of your book for the preparation, in that after every explanation I have given extra mile, a box is given extra mile, or also know, or must know, ऐसे करके कुछ tables मैंने दिए, boxes दिए, make sure to go through that. ठीक है? Because that is about that question, around that question, what kind of other question examiner can think of has been given there. Okay? You just have to repeat whatever you have done here, step 1 and 2, इसी को आपको repeat करना है. Attend the grand test after 6 to 7 subjects are done. Do not wait for the entire 19 subject to finish. As long as you are done at least 6 to 7 subject, at least 1/3 of the subject, as long as you are able to, as long as you are done, start giving your grand test already. It's absolutely fine not to score more than 200 or let's say 180, 190, but make sure that whatever question that are going to be asked from this topic, you are correcting it. Maximum you are making correct. You might be asking, sir, what is the advantage that I am going to get? I have not read this subject and why should I solve this question? It's absolutely fine. You are not getting any negative mark. And at the same time, you are programming your brain. Your brain is getting programmed. Okay, in the gynae, I have not read gynae, but this type of question is being asked. So in the upcoming days, when you start gynae, you already have an idea this type of question is being asked. Or let's say you have not done surgery and you are attempting the surgery question. Maybe by next week or next month, if you are going to start surgery, you must have done, let's say, 1 to 2 GT, and you already have an idea, okay, what kind of question examiner is asking from the surgery. So it's like pre-planning. आपका brain already उस बात के लिए prepared है. You're not going to get a shock, है ना, after getting this kind of question or those kind of topics. So you just have to class notes, MCQ, repeat. I am talking very simple. And you will have to make it the same simple. Make it more simple. I have seen students doing MCQ from 4 different areas, 5 different areas, doing their notes from 4-5 different areas, but not able to revise it. That is the worst mistake anyone will ever do or anyone has ever done. See, if you are not able to revise the thing, don't start it as a simple. Okay? Keep it very, very simple. Keep one notes, MCQ source. You can do as much as MCQ that you want. Okay? Repeat step 1 and 2. Give grand test. That's it. The role of Unacademy and schedules, I'll be talking about that. Of course, the time management is the most important part. And like we used to see in the offline classes, that if there is a class at 9 a.m., we used to reach there at 9 a.m. and we used to finish our classes on time, and then we get the time to revise, and we used to revise. The only problem that we are getting with the self-study students is they are not able to manage the time. They are not able to maintain that schedule that they have made. Let's say you have made already a week schedule or a month schedule, but most of the time I have seen or I have got the message, sir, I am making it, I am able to follow for the first 2 to 3 days, but after that I am lost. I am having a particular, let's say, work, or let's say there's a work in the family, there's a work with the friends, or there's some hospital emergency, I have to rush here and there, and my whole schedule is shattered. Ask yourself, if you would have a class at that particular time, or let's say at 9 a.m. you have a class, so you have to get up at 7 a.m. Make sure you at least flip your pages of whatever you have studied, and then you have to rush to the class. Would you get into this kind of distraction still if you would have a class? The chances are much lesser. The chances are high when you are managing yourself, because you think, okay, I'm free here, I'm at home, I can do some extra work as well, and that is when it all goes wrong. Okay? So time management is the most important part. And how Unacademy is helping you? Of course, there is a live class. So you'll be getting a time, okay, this is the time that you have a class, okay, go to the class. Finish whatever that is being taught in the class. If I give you a lecture of cardiovascular system, 6 hours, and if I tell you, okay, I have taught this cardiovascular system in 2 hours, plus 2 hours, plus 2 hours, with a break of 15 to 20 minutes in this. And if I tell you, okay, in one day, finish cardiovascular system, or in 6 to 7 hours, finish cardiovascular system. I mean, on the regular, on any regular day, I'm not challenging, but I'm just telling you, if it is given to you, would you be able to finish in the same way how we have finished in the class? The possibilities are there, but lesser, much lesser. Maybe you have listened to the lecture for 20 to 30 minutes and you got a call. or you got someone is calling from outside, or whatsoever a problem that you have got, you're going to pause it there. And or you got a message on social media, okay, there is one person is chilling out at this particular beach with 39 others. You'll go after that, okay, kaun hai ye with 39 others? You'll go on surfing the internet, and definitely by the time you realize, you have already wasted your 1 to 2 hours in that. So time management, definitely you'll have to schedule yourself, goal oriented study. So put yourself a timer. Put your timer, okay, in this particular time, in this particular hour, I'll have to finish this much. If you're reading from the notes, okay, these are the number of content, these are number of pages, this is the chapter, I'll have to finish in this time. It should always and always be goal oriented, because if you do not put yourself a goal, if you do not give yourself a goal, there are chances you might stuck on a single topic from morning till evening. Maybe your eyes are looking at the notes, but you're lost somewhere else. So whatever you're going to read, it should always be a goal-oriented study. Organize yourself. That in these many days, I'll be finishing this, and after this, I'll have to give the test, then GT, repeat 1 and 2 again. Eliminate the sources of distraction. It could be anything. The list of distraction are endless. Whatever that is coming between you and your studies, you and your result, if it can wait, put it on waiting list. This is the simple term, and this is not the first time I am speaking. Previous to you, with around 13 to 14 batches, I have told the same thing. That if something can wait, if something is coming, if something is coming in between your studies, in between your career, you and your examination, put it on waiting list. Eliminate. It should be your phone, it should be any wrong relationship or whatsoever kind of distraction that you're having, put it on waiting list. I'll handle this after the examination. Right now, my studies. So once I have read it, let's say I'm going for bathing, why not revise whatever I have read while I'm bathing? Think about it. Retrograde. एक बार सोचिए तो मन में, try तो करो. Think about it. Okay, I have read this particular topic, and this is what I have read in this. These are the information that I have got to learn in this. Eliminate the sources of distraction. So time management, goal-oriented study. You'll have to keep yourself organized that these many subjects should be done in these many hours. These are the very, very important points. You'll have to plan ahead of time. All the students, those who are doing the self-study. What do I mean by this? So let's say you have a week schedule that I'll have to finish in this week. Example, I have to finish in this week, let's say pharmacology and anesthesia. Okay? That is your 1 week's plan. Now what you're going to study tomorrow, when will you decide this? Tomorrow morning? Are you going to start with the MCQ, or you are going to start with XYZ chapter? If you are going to read anesthesia, are you going to start with inhalational agent, general anesthetic, or IV anesthesia? What are you going to start with? When will you decide it? Tomorrow morning or tonight? It should be ahead of time. What you're going to do tomorrow, plan it ahead of time. Train your brain that tomorrow these are the topics that I have to finish from this time to this time. Plan everything ahead of time. Set a realistic goals. Many students will be telling, okay, in this week I'll finish surgery, medicine, pharma, patho, anesthesia. 1 week काफी है. 7 days होते हैं ना, 7 subject मैं कर दूंगा, है ना? By the end of the day, if you're not able to finish even the anesthesia, that is when the depression sets in. यार मैं तो एक subject भी नहीं कर पाया. I could not finish even a single subject. I'm totally waste. I'm worthless. Good for nothing. That will start hitting your brain in a negative manner. So you'll have to set a realistic goal. Whatever you can finish. You know well what's your reading, what's your reading speed. You know well what's your MCQ solving skill and what's the speed of MCQ solving. Set realistic goal. Set something that you can finish rather than making any unrealistic goal. When you read it, let's say on a daily basis, if you are reading 10 to 12 hours or more than that, you'll have to study with breaks. Don't go for long study hours. Don't make your neurons to go into fatigue just in the very first go. No. Give a break. I would say at least 90 minutes to 2 hours. There are multiple techniques that you can find in social media by different people those who are talking about the time management and all, ठीक है, by the different motivational speaker that apply this technique, apply that technique, and after every 30 minutes take a break. Come on, you have a 6 month time. Be realistic, talk realistic. After every 30 minutes, if you take a break, how long does your break going to last? If it is going to last for even 15 to 20 minutes, because you do not have a particular let's say a schedule in which you have to that is going to compel you to come. I mean, आपका ब्रेक है ना, आप खुद उसको एक्सटेंड कर लेते हैं. लाइव क्लास तो चल नहीं रहा है, ना ही देर इज ऑफलाइन क्लास वेयर द टीचर हैज स्टार्टेड, ओके आई हैव टू रन फास्ट. So studying with every 30 minutes break, according to me, this is my view, it is not very much effective. I mean, I tried, but I found it less effective. So I continued with the 90 minutes and then 20-25 minutes. You can make it 90 minutes to 2 hours. एक बार बैठिए 90 minutes to 2 hours का एक सेट कीजिए, फिनिश करिए. If you are going to take a break every 30 minutes, you see how much of the topic you will be able to finish. Not much. You don't have that much time, है ना. वो PhD करने वाले लोग हैं या जिनको है ना कुछ और चीज़ें करनी है, उनके लिए है वो. आपके लिए समय कम है, 19 सब्जेक्ट है, एक बार पढ़ना है, 3 बार रिवाइज करना है. यू डोंट हैव दैट मच ऑफ टाइम. So study with breaks. Definitely I will be telling you, I would be recommending after 90 minutes to 2 hours, take a small break of 15 to 20 minutes or 25 minutes. Make sure that you are following this particular very strictly. It's not like okay 15 minutes का ब्रेक था यार, आधे घंटे हो गए, एक फ्रेंड का फोन आ गया, वो अपनी बात बताने लगा, वो अपनी ब्रेकअप के बारे में बताने लगा, एंड आई हैड टू कंसोल हिम, और पता चला इसमें मेरी हाफ एन आवर चलेगा. So, थोड़ा कंट्रोल तो रखना पड़ेगा. आर्मी लेवल की ट्रेनिंग चाहिए इसमें, ठीक है. अवॉइड एनी काइंड ऑफ फ्यूचरिस्टिक थॉट दैट इज पुलिंग यू डाउन. नो फ्यूचरिस्टिक थॉट जितने भी हैं, व्हाट विल हैपन इफ, व्हाट हैपन इफ, है ना, कोई भी नेगेटिव थॉट्स अवॉइड. सो यू हैव टू प्लान अहेड ऑफ टाइम. वंस अगेन set a goal which you can finish it, because when you set a goal, when you finish it, you get a sensation, you get a feeling of achievement, and that boosts you, that causes lots and lots of release of endorphin, the positive, you get motivated to work more in that direction. But the minute you are not able to achieve something, you're not able to achieve your goals, it is going to hit you negatively. Study with a break, definitely. My recommendation, at least 90 minutes minimum, 90 minutes to 2 hours पे आप एक छोटा सा ब्रेक ले लीजिए 15-20 minutes का. that is more than enough. No negative thoughts, no futuristic thoughts. Now how are you going to do? Let us talk about this. 10 to 12 hours per day. Of course, I think you do not have any other work. As I told you that if something can wait, put that thing on the waiting list. Next 5 to 6 months should be you and your books, your notes, your MCQs. That is all. Then one more thing that I've seen, most of the students, they have started one subject and they're reading that subject continuously for 5-6 days and they close that. Next time they open the subject after 2 months and everything that they have read in these 5 days are gone after 2 months. Then they realize, okay, I'm totally gone. And I have spent my this much time, now I cannot recall. It seems like this is the first time I'm reading this subject. I have never seen these terms. So for them, I would tell you that stay in touch with one subject for a long time. Rather than finishing something in 5 days, finish it in 15 days. But not only one subject. Along with that, you take at least 1 to 2 more subjects. So at least 2 to 3 subjects per day. My recommendation, I say 2 to 3 subjects. So how do I tell you? I will be sharing that whole schedule here. Decides the morning schedule ahead of time. This I have already told you. So important points. 10 to 12 hours का per day का schedule बनाइए. 2 to 3 subjects per day. Decide morning. So what are the important points that we have? Let us take about this one. So on an average, this is July first week. Your examination will be in December. So if I say on an average you are having around 170 to 180 days. Let's calculate with the 170 days. आज से बात करते हैं. Today is July 6. Today अगर हम आज से देखें तो around 170 days हैं. So we have, let's say, July 5-6 days छोड़िए. So July, August, September, October, November and December. So we remove December. So even if you say 160 days, even not even 170 days, we have around 160 days. Because December में ऐसा तो नहीं पूरा December आपके पास है, हो सकता है December के second week तक आपका एग्जाम हो जाए. So you have on an average around 160 days or लेस देन दैट। इतने दिन का शेड्यूल आपको बना के चलना है। नाउ लेट्स सी हाउ आर यू गोइंग टू प्लान। द प्लान शुड बी समथिंग लाइक दिस। दिस इज फॉर ऑल दोज आर डूइंग द सेल्फ स्टडीज। घर पे बैठे हैं, लाइब्रेरी में बैठे हैं, अपने लिए खुद से बोलें सर मुझे खुद से पढ़ना है, टेल मी कैसे पढ़ो। 3 subjects like anatomy, physiology, biochemistry, on an average we get to see 15 to 17. They are integrated, so sometimes you are not able to understand whether they are anatomy question or ortho question or anatomy or surgery question. Likewise physiology, biochemistry. So if you are going to put, let's say, a minimum of 5 days for each of them, it will be for 15 days. Now you will be asking, sir, should I study 15 days like this, anatomy, physiology, biochemistry? No. You have to use the permutation combination. I'll tell you what are the different combinations that you can utilize. I'll tell you my views, you can utilize according to your availability. ठीक है? So 15 days के लिए subjects like medicine, surgery, OBG, you are going to get 35 plus marks from each one of them. Sometimes it's little lesser or more than that, but on an average it's 35 plus marks. So I would tell you, okay, spend at least 11 to 12 days, and on an average you'll be getting 35 to 36 days for this one. Subjects like patho, pharma, PSM you will be getting in 7 to 8 days. If you do it in 7 to 8 days, you will be getting around 20 to 24 days. Subjects like ENT, pediatrics, ophthal, micro, you can do it in 4 to 5 days. Now remember these days that I have written here, these are just exemplary. You guys can create a schedule quite similar to that. If you think, okay, my ENT is quite good, I can finish it in 3 days, absolutely fine. Spend that time in other subject, let's say medicine. My PDI is good, I can finish it in 2 days, it's absolutely fine. Spend that in some other subject. So you can put, like, let's say 3 days for each subject, so it will be done in 15 days. You have to draw it. So for subject like this, let's say I'm putting 1, 2, 3, 4, so it will be taking around 20 days. Psychiatry, radio, ortho, anesthesia, forensic and skin or derma. Prof subject you are going to get 3 days per day, so it will be roughly around 6 into 3, 18 days. If you do the calculation, you will be getting on an average, if you are going to, like, let's say if you are going to make this like 4 to 5 days, or if you are going to make it like 7 to 8 days, you will be getting somewhere between 100 to 110 days. That means in around 3 months or more, maybe a little more than that, you will be able to finish it. Very lavishly you can finish. ऐसा नहीं कि ये नहीं हो पाएगा, definitely होगा. ठीक है, you have to be more sincere. 100 days में एक बार आपको करना है. Now this includes your subject, and on the regular basis, as I have told you that earlier I used to say 70-30. आज मैं बोल रहा हूँ you can increase the theory portion because this is the first. So 75% of the time on the regular basis should be for your theory. 25% of the time it should be for MCQs. So on an average on the daily basis 2.5 hours for MCQ. इसके लिए आप रिजर्व रखें. Second and third reading के लिए you will be having around 60 days, so 50 to 60 days. So you will be able to finish in 160-170 days the entire thing. So let us see how it goes. How are you going to make the combination? ठीक है, I'll be uploading this one again in the groups that we have. I will upload this one so that according to this only you make your own schedule as well. ठीक. Example of a one daily plan. I'm giving you one example. So if you have, let's say, a 12-hour study, so I'm 2.5 hours I'm keeping aside for MCQs. I'm telling you for theory portion how are you going to do. So let's say you are going to make one combination of physiology, pharmacology, anesthesia. Now there is a subject called pharmacology from where 28 to 30 questions are asked, physiology around 15 to 17 questions are asked, anesthesia around 5 marks are asked. So you can put times like 4 hours, 4 hours and 2 hours. If you think your physio is good, you can put 3 hours for physio, 5 hours for pharma, 2 hours for anesthesia. Or if you feel your pharma is good, you can dedicate the extra time for the physio. It is totally up to you. You guys can decide. ठीक है, 4 hours plus 2 hours. इनमें आप these 3 subjects. Now if you are going to do these 3 subjects, listen. How many days did you got for physio? How many days did you got for physio? You are having 5 days. How many days you got for pharma? You are having 8 days. So कितना हो जाएगा? 7 to 8 days. So you have around 13 days. है ना, 12 to 13 days. How many days you got for anesthesia? You got 3 days. So 13 or 3, 16 days. Now you are going to stay in subject with these 3 subjects for 16 days. But by the end of the 16th day, you will be able to finish 3 subjects in a bulk. You are going to stay with this subject for the 16 days. You plan in a way that 4 hours pharma, 4 hour physio, 2 hour anesthesia on the regular basis. Then you might be telling, sir, what will I do with the anesthesia for 16 days? Anesthesia is very small, I will be finishing them in 10 days. I said, absolutely fine. Dedicate that extra time in these 2 subjects, pharma and physio. Do the MCQs of anesthesia. Utilize the time for other subjects. But in तीनों को 16 days में, example, these numbers are, you can make one day up and down depending on your own comfort level. You can make another permutation combination, like let's say anatomy, surgery, orthopedics. A subject like surgery where 35 to 38 questions are asked, anatomy 15 to 17 are asked, orthopedics 5 to 7 questions. Sometimes it is integrated with surgery and anatomy. So these are just example. You can choose your own combination, but this I am choosing because integration are mainly occurring with these subjects. So let's say you are putting every day 3 hours for anatomy, 5 hours for surgery, and 2 hours for orthopedics. Now let me ask you, how many days you had for anatomy? Again 5 days. Surgery, how many days? 12 days. So 12 or 5, 17 days. And then you have orthopedics, again 3 days. So 20 days. You are going to stay with this subject for around 20 days. Slowly and slowly you are proceeding. If you are able to finish your orthopedics in, let's say, just 12 days, it's absolutely fine. Utilize that 8 days, the extra 2 hours that you are getting in these 8 days, either on your weaker areas. You have weaker areas. I remember I told you have a weaker area. Utilize that for doing the MCQs, or you can utilize it for subjects like surgery or anatomy, which is there along with this. But the sincerity and honesty should be like this, that in 20 days you have to finish this. You can increase or decrease the time, totally depends on you. You can make another combination like let's say biochemistry, OBG, PDA. So अगर देखेंगे तो पैरेलल में आपका एक बेसिक सब्जेक्ट भी हो रहा है, एक क्लिनिकल सब्जेक्ट हो रहा है, यहाँ पे 2 क्लिनिकल सब्जेक्ट आ गए. So let's say you're putting 3 hours for biochemistry, 5 hours for OBG, and 2 hours for PDA. Do it the same way. So biochem 5 days, OBG I think around 12 days, so 17, PDA 2 days, so around 19 days or 3 days. So again this is also going to be for 20 days. So for 20 days stay in subject touch with this one. Pathology, micro, derma. So patho, how many days? Patho you have let's say 8 days. Micro you have for 5 days, 13 days, and derma you have again 3. So around 16 days you are getting here, 16 days. Once again this subject permutation combination you can choose your own. So patho, micro, derma you are having 16 days. Stay in touch with patho, let's say 5 hours a day, micro 3 hours a day, 2 hours a day for derma. If you are able to finish any of this ahead of time, go ahead, spend the extra time on your weaker areas or on patho or on derma. Likewise ENT, ophthalmic psych. This way guys, slowly and slowly you will be able to finish your first reading on time. This is only going to be possible if you write it on a paper that okay, these are my master plan, these are my hours for the entire 100 days, how am I going to finish this, and these are my number of hours. If you want to make it much shorter schedule, you can do that by squeezing the number of hours accordingly. For our upcoming students, what is the master plan that you have? Okay? You will be sorry, this is not going to be possible by August. You are going to start in July only. Okay? So when are you going to finish it? Finish the first syllabus, first reading. July से start करोगे. So July, August, September. So I can tell you by October first week, October, let's say within October 10, 2022 तक ये हो जाना चाहिए. ठीक है, ये हो जाएगा. Then after that by October, let's say you can take another 30 days. So by November, this is the same thing. By November 10, 30 days again. Then the next one will be around 20 days. ठीक है. by the end of November you should be able to finish this one. By the end of the November end, November 30 तक ये second 20 day वाला खत्म हो जाए. Then if you are having let's say 10 to 12 days, then the last revision 10 to 15 days का it should be done in December, within December 10. If the examination is going to be around 10 or 12, it totally depends on the notification that we are going to get. But after reading once, it's rightly mentioned here that you'll have to finish. This is your master goal. Okay, this is my long term goal, that after this many months I'll be finishing the first go. This should be my schedule for 100 days. On the regular basis I'll have to finish that, and this is how I'm going to revise it. In the 54 days or in the 60 days, how am I going to revise it? So you'll be making a schedule quite similar to this, as I have told you that this is the first reading wala 100 days. Now for the 30 days you have to make, and again for the 30 days, 20 days and 10 days. ऐसे करके आपको बनाना पड़ेगा inverted pyramid. So first read मान लीजिए आपने दिया 100 days का, then the third one you gave let's say 30 days का, then you gave let's say 20 to 25 days का, and 10 to 15 days का आपने यहाँ दिया. This is how you are going to put an inverted pyramid, and this is how you are going to finish. ठीक है, 160 170 डेज का शेड्यूल आपके लिए आएगा. और स्टार्ट कब से करना है? व्हेन आर यू गोइंग टू स्टार्ट? व्हेन विल यू स्टार्ट? एनीवन? व्हेन डू यू थिंक यू आर गोइंग टू स्टार्ट? नेक्स्ट मंथ? नेक्स्ट वीक? व्हेन कैन यू स्टार्ट? द राइट टाइम इज now. Let's say we are finishing this today, and today you are going to again go ahead and pen it down. Even if you are going to get a little bit of less sleep, absolutely fine. Next morning what you have to start, it should be ready by now. आप हमसे promise करो, whatever I am going to decide on the basis of this schedule that I have told you, you are going to start tomorrow. You might be asking, sir कौन से subject से start करें? There are questions. I have seen that. I have heard that. Not new for me. Which subject should I start? I always suggest, what is your favorite subject? Which subject do you think is very easy? I tell, start from there. To start, it should always be good. To start, it should always be a confidence booster. To start, it should always be something which you are mainly or actually interested in. If I tell you that you start with something which is very difficult, एक दिन में, just one day and everything will go. You say, नहीं हो पाएगा. I cannot do that. So start with your favorite subject. What is your favorite subject? अगर gynae favorite subject है, start with your favorite subject. Read about different pelvic diameters. Read about different fetal head diameters. है ना? Read about the important points that have been given in FMGE solution. Make this and start from this one. Okay, let's say you are going to make OBG pedia and साथ में you wanted to take something else. Let's say you wanted to take what can you take? Let's say you want to take derma. It's totally up to you. Or you wanted to take physiology. It's totally up to you. ठीक है? So start with your favorite subject. ठीक है, जो भी आपका एक 100 वाला पीरियड था, ओवर करिए. कम आउट ऑफ दैट, स्टार्ट एज सून एज यू कैन. दिस इज द मास्टर प्लान दैट यू हैव. आई विल बी शेयरिंग दिस इन द ग्रुप, ऑल्दो previously I have already shared. You can easily find it out. Then I will also be sharing you this. This is one of the table that we have made that always help you in staying organized and staying updated at all times, that what all subjects you have done and what all subjects are left. So this is something that you keep it in one corner, and you are going to use it only every 2 to 3 weeks. You will be using this only 2 to 3 weeks. So let's say you are going to start with your favorite subject OBG. Once you have finished OBG, you are going to mark, okay, let's say I have done OBG. Then I have done OBG ka MCQ. Let's say if you are doing MCQ from the platform of Unacademy, okay, you have done FMG solution, you put it. Then next time, I mean after 100 days, when you are going to start OBG again, put the second plus. After this, if you are going to start, let's say another one, let's say pharma physio. So as soon as you finish this, you put a plus. This is going to help you track the studies, the tables. This table is going to help you the studies the topics, the subject that you have done in a single go. Okay, all these are done, and then these are the things that I have to finish. So you can use class notes, MCQ, FMG solution. If you are joining anything extra, that is totally up to you. But जो इधर वाले first 3 हैं, इन सब में at least 2 to 3 tick should be there for all of you. 2 तो नहीं बोलूँगा, 3 to 4 रहे तो बेहतर है. The more the merrier, I would say. So 2 to 3 ticks minimum should be there in each one of them. ऐसा नहीं कि हाँ ऐसे ही ठीक है आज सो के उठे और सब में 2 लगा दिए, नहीं. Finish it and then put at least 2+ marks. And every time you finish it, you put it a plus mark. If you can do it anything extra, absolutely fine. But I would strongly recommend first focus on these 3. This is the one. What's your source? Once again, your class notes, FMG solution, plus any other sources of MCQs. Whatever sources that you choose, it's totally up to you. No source is bad. I never consider FMG solution as a MCQ book. First of all, it will be a gist of all 19 subjects. It will give you the mindset. It will give you the idea. Okay, what kind of question can be framed in the future? What kind of topics can be framed in future? The key for this examination, guys, is the revision, and you always keep it simple. Do not complicate it. Class notes, FMG solution plus MCQs. That's it. Repeat the same. And that is all. Now I'll be taking the questions that is there from all of you guys. I hope that I was able to give you the important points, that how are you going to start your studies and when are you going to start. All of you will have to make a promise that when am I going to start. Okay, you have studied, you could not get this, but there is no point of spending more time thinking about that. I have seen very brighter students, much brighter students, those who are currently doing some subjects like, let's say, neurosurgery. They could not do this on that particular day, possibly because they got a couple of difficult questions. Lines, 10 difficult question aa gaye and they got shattered. They started crying in the exam hall. I have seen a couple of students, those who are very good student, they got first 10 questions very easy and they thought, okay, the rest of the paper is going to be very easy. They got into overconfidence and they made the mistakes that they never imagined. But of course, they did realize that mistake, they worked on that mistake, and they passed this examination. So identify, ask yourself, where is the problem? Give some time for your weaknesses, at least 45 to 50 minutes on the regular basis. Whatever schedule that I have told you, the first studies you have to finish by 100 days. Then the next read, and the final revision. Start giving GT once you're done with at least 6 subjects, 6 to 7 subjects. Okay? Make it very simple. Notes, FMG solution, do your MCQs, repeat the same. Don't complicate it. Don't read from 10 different areas, 10 different. There are n number of coaching institutes, there are n number of MCQ sources. Don't think that this MCQ is better or that is having a difficult one, so that will be better. No. That is all nonsense. Pick one. Take help from your seniors, those who are sincere. Pick one, continue with the same. That's it. One notes, one source of MCQ, one FMG solution. These 3, repeat the same. As simple as that. And for all those who are saying, okay, I'm going to attend for the first time, what should be my strategy? I would simply say, whatever notes, whatever class that you have joined, attend it without missing. Make sure you are making your own handwriting. Attend classes, make notes in your own handwriting. Do not wait for the PDF. If you are joining the Unacademy, do not wait for the PDF. It's always advisable to make your handwritten notes in your own language. However, if there is any problem that you are not able to cope up, or if there is any problem in which you are more comfortable with the PDF, it's totally up to you. Make the notes. You are going to have 4 to 6 hour classes on the daily basis, max to max 6 hour, daily 4 hours class hoga. Revise, because you are having ample of time in reading this. And do you know the students, those who are attending for the first time, they have high passing percentage compared to the repeaters. Why? Because they are getting more time. They are studying stress free. They are not carrying the load of the previous exam. Most of the students are carrying the load, and this is what I am telling you. Remove that burden, remove that load. It may be a little difficult, but remove it. And what will the world say? What will the relatives say? What will the friends say? Let them say. They will say everything, anything. They do not know what you are going through. They do not know how much of the time that you have spent. They do not know that you didn't attend any party during this particular period. They are there to comment only. Do not listen to them. Accept that. Start it now. For all of you, those who are attending the class, attend the class, make notes, revise MCQs. This is the simple funda. कोई रॉकेट साइंस में बता ही नहीं रहा हूं आपको, ना कोई जिनी वाला बात बोल रहा हूं कि जिन आया और बता दिया आपने ये कर लो, ऐसा कुछ नहीं. अलादीन का चिराग नहीं आएगा. सिंपल सा बस एक ही काम करना है. यू हैव टू बी डिसिप्लिन्ड. ठीक है. ज्यादा डिसिप्लिन कहां चाहिए? जहां पे आप खुद से सेल्फ स्टडी कर रहे हो, बिकॉज यू हैव टू मेंटेन इट. इफ यू हैव मेक अ शेड्यूल, ओके आई हैव टू सिट एट 9 AM, नो मैटर व्हाट हैपेंस, sit at 9 AM. You should be on your table at 8:50, 8:55. Start your studies at 9 AM. उस लेवल का ट्रेनिंग चाहिए, आर्मी लेवल की ट्रेनिंग चाहिए. ठीक है. When are you going to start? Now is the time. Make the schedule. Start now. All of you will be making the promise that yes, we will be starting it now. If there is anything, any problem with the schedule, or if you are having any kind of trouble, you know we are just one click away from all of you. Any of the teachers, आप knock करिए किसी भी teachers को, we will be available right away. As soon as we see your message, we will be there for all of you guys. All right, now let's take the question. Sir, I did not know anything, never studied in college, how to prepare for FMGE 2023. Sahil Khan, I would tell you, follow this step. Sir, your Telegram channel name, doctor, we are not allowed to share, but if you search, you can easily find it. When you are starting new batch, I just started and finished one new batch for FMGE. 2 days ago I finished, just 2 days ago. ठीक है. So it is a 52-hour class in FMG के लिए, ऑनलाइन लाइव क्लास में एक मैंने 52 आवर का क्लास लिया है. It's the recorded version session is already available. You guys can attend that. I'm in my final year preparation for FMG 2023. Again, the same thing for you. Anyone who has not attended, and if you are in final year, you join one. Let's say if you are joining Unacademy, you join a particular batch, one batch, the comprehensive batch, which is having a minimum of 500 to 600 or 700 classes, where subjects like pharma, patho are having a minimum of 50 plus hours. Join that particular batch and attend that. New focus by FMG start on the platform. They have already started. Pharma उसमें 2-3 दिन पहले मैंने खत्म किया in 52 hours, as I told you already. Again, Dr. Anda Huzaifa, I'm in final year FMG 2023. Next year है, तो again मैं वही बोलूँगा, आपके पास बहुत टाइम है. Plan it nicely so that you hit it in the very very first attempt. You make sure that you are attending the class on time. Attend this. Make your own notes in your own handwriting. Revise it. Do the MCQs and keep in touch with these throughout the time. Now go ahead. Put your queries if you are having anything. If you are having any query, you can put it. If there are none, then we will call it a night today. I hope I was able to convey the basic message here, how you are going to make your schedule, how you are going to continue with the schedule. Do remember that whatever you choose, stick with one. If you are having difficulty in choosing, take help. Talk to your teachers, talk to your seniors. They will guide you that what is best for you. If you are not able to decide, take help. But no teacher will give you that kind of advice that okay, this is good, this is better in any of the social media. And talk to them. Or no senior will ever write it on their Insta handle that okay, this is best or this is bad. I don't think so. That's a good idea. But talk to them, take a genuine advice. What is better for me? I'm not able to cope up with my schedule. Should I follow this or should I follow that? You'll have a genuine idea about that. FMG 7th edition, as I told you, it's in the process already. Should be out soon by the end of this month or August first week. That is what we are expecting if everything goes right. North Indian, are you still there, doctor? Any other student, those are having any other query? If you are having any more query, as the slot is open for the question. What about review books? See, there are n number of books. Again, the same thing I am telling you. Review books is not having anything extra more than what you have in your notes. If you are getting anything new from your review books or from your MCQs, you make sure that you have a couple of sticky notes to stick on your notes. At the end of the first go, you should have a single source of study, so that when you revise second or third time, it should be a single notes. Okay? There are n number of review books. You won't be able to finish all of them. So trust on any one. If you're following review books, you can follow that. If you can finish that, well and good. But I always prefer the class notes, because smart study only can help you out here. You have to read it once, revise it 2 to 3 times. So the best savior will be your class notes. Your class notes are really, really powerful, guys. Very powerful tool. Do not underestimate your class notes. I'm telling you guys. Self-study or repeat coaching. See, I'll be very blunt here. If you have already attended a regular class, if you're satisfied with that, do the revision of the same. Don't spend much time. But if you think you're not able to solve much question from there, it's high time that you think. And if you wanted to make a decision, this is the time. Do not make the decision after 1 month. Why so? Because after 1 month, many of the subjects will be finished. Like, let's say one of the FMG batch we have started, and in that I have already finished pharma. So the next batch will be started. In that also I'll be finishing, but that will take another 1 to 2 months. Okay. So if you want to join a new batch, this is the right time for you. If you're satisfied with whatever you have attended, only you can tell. If you're able to solve MCQ from there, simply attempt the test. Simply revise the same. Do not try to overburden yourself with attending more number of classes. That's all. Zia Imam 2023 FMG or next. बहुत difficult question है. We are expecting let's say next most likely, but we cannot make it here. I mean, we cannot comment officially because it's not yet official, so we cannot comment anything on that. PYQ, how many year question I should study? See, PYQ kabhi bhi, once again, is not repeated. It's a topic that are repeated. So whatever that has been given in FMG solution, that should be sufficient. Okay? So FMG solution mein you'll be getting more or less around 6 to 7 years. 7 years के क्वेश्चन आपको आराम से मिल जाते हैं. टॉपिक वाइज सेग्रीगेट कर दिए हैं. सो वी हैव ऑल्सो डिवाइडेड देम इन मल्टीपल सेगमेंट्स. लाइक PYQ का एक सेगमेंट है, देन देयर इज अ इमेज बेस्ड सेशन, देन देयर इज अ सेक्शन ऑफ क्लिनिकल बेस्ड, देन देयर इज अ सेक्शन ऑफ वन लाइनर्स वेयर यू आर रीडिंग इट इन योर फ्री टाइम, है ना. इफ यू आर टेकिंग द ब्रेक, इफ यू वांट टू गो थ्रू दैट, यू कैन गो थ्रू दैट, है ना. रशियातुन मराठी Mulga. Problems in completing topic on times, lagging behind, not working as per schedule. 2023 FMG. Doctor, that is what I was telling, that you have to make realistic goal. If you already know that, okay, I'm not able to finish it, then definitely it will hit you in a negative way. So you have to attempt the examination in 2023. You have good amount of time, है ना. Plan accordingly. If you are able to finish, let's say in 1 hour, if you are able to finish only 5 pages, make a schedule of 5 pages only. Make a realistic goal that you can finish. Make sure that your confidence is being boosted every evening rather than getting shattered every evening. Make sure you have a schedule for the morning just night before. If you are going to sleep now. You make sure if you wake up in morning tomorrow, which notes should be there in your hand. You should think about it. You should keep it on your table. Don't think मैं सुबह उठ के I'll search it and then I'll read it. No, wrong approach. Before you get a coffee mug in your hand, you should have your notes. If you're planning for starting with an MCQ, better idea. Start with an MCQ. But make sure whichever MCQ that you are going to do, it should be in front of you. If you're going to do online, okay, your phone is there always with you. सी ऐसा नहीं कि नेक्स्ट आ जाने से कुछ बहुत ज्यादा चेंजेस आपके लिए होंगे, ठीक है। ड्रग ऑफ चॉइस फॉर एट्रोपिन पॉइजनिंग वही रहेगा, चेंज नहीं होगा। क्लिनिकल बेस में आ जाएगा क्वेश्चन, ठीक है, पेशेंट आया इस सिम्टम के साथ आया, कैसे ट्रीट करोगे, या ट्रीट कर दिया नेक्स्ट क्या करोगे, ठीक है। सो नेक्स्ट बेस्ड अप्रोच इज नॉट गोइंग टू अफेक्ट यू मच, ठीक है, until unless we get a clarification that they are going to conduct it in a multiple steps for you as well. तो अभी उस पर क्लैरिफिकेशन नहीं है अभी के लिए। वट एवर you know that okay, I have to study 19 subject, I have to revise, at least do that, no? At least do that. Because if it is going to be announced that okay, there will be practical session as well, there will be step 2 in which you will have to do clinical demonstration, then you will have to do only one part because you are ready with the one part. So whatever you know that, rather than going into stress that okay kya hoga, we don't know kya hoga, you don't know kya hoga, why to get stressed then, why to worry then? Whatever you know right now, I am telling you, okay, attend this much classes, make sure you have the notes, revise this. Basic अपने basic तैयारी तो complete रखो आप लोग. Make sure you have a basic preparation. Nomad Medico, any info about FMG Solution 7th edition? Doctor, yes, it will be coming as I have announced it already. The work has almost done. It will be coming by the end of this month, most likely. If not, then July, August first week, if everything goes well. Don't know how to study FMG or next questions कौन NEET PG और FMG, आप FMG वाले ही करिए अभी, ठीक है। डॉक्टर रशियातुल मराठी मुल्का. Anyone else who is having any other query? If there are none, then we'll call it a night. And of course, if there is anything that is left over, you guys know where to approach us. Just write your query or tag us. We'll definitely be there with you in no time. As soon as we see that, we'll be there with you. Just follow this step, make your schedule and start learning. Do not wait for a particular time. है ना, मुहूर्त आने का समय है ना, मुहूर्त का इंतजार नहीं करो, आज ही है, स्टार्ट कर दो आज से, ठीक है। हो गया, जितना भी सैड फेज था उसको ओवर करो, कम आउट ऑफ दैट ग्रीविंग फेज, ग्रीवेंसेस आर ओवर, दैट फेज इज ओवर, स्टार्ट योर प्रिपरेशन एज सून एज यू कैन, ओके। Anshul is asking, will it be okay enough, sir, again revision of notes and again MCQ practice from solution 6th edition? I don't think it is insufficient. Definitely it is. Just if you have already given the exam, identify your weaknesses, work on your weaknesses. You have to work on your weaknesses, okay? And definitely it shall be sufficient. And if you are let's say willing to get updated, we are having lots and lots of free classes on the platform here in the special class. You can attend them at any point of time and you can get yourself updated. You can revise at any point of time that you want. Okay, thank you very much to all of you. I hope I was able to convey the basic message here, and go ahead, start your preparation, and if there's any problem you can just reach out to me. I'm just one click away from all of you. So have a good night to all of you. I'll see you around.